through outreach programs. So it is readily available, that availability has increased exponentially since the onset of our toxic drug crisis in 2016. That's also the public health messaging that I mentioned earlier about sort of not using alone, was also meant to reinforce the importance of naloxone use. If you're not using alone, then you have someone who is able to help you. Um, the challenge I think that we were having is naloxone. It yeah, naloxone only works if you can administer it. And so when people are using these very toxic drugs with many adulterants in them, they're finding they'd be sort of going over very quickly, and because of that, had no opportunity to use the naloxone they had. So that was what was important to us in focusing on this. So everybody knows that this is incredibly risky. And if you're using with someone else, you've got the tool available to help save your life. We didn't want to approach the question or the data from the expectation that people who are using drugs don't know or understand the dangers or what to do. And we found it really striking that the risk of overdose for people in most of these circumstances, right, that would cause them to at least let somebody know in their home that they were using so that the naloxone kit was available, that preserving those relationships or those risks to their relationships were seen to be so much greater than the, I guess it was the theoretical risk of overdose that they take, that they're willing to roll the dice, as it were, because of the certainty that would come with the harm to relationships with people who are important to them, or to relationships that would affect their social standing or their opportunities in their community, their housing, their ability to keep their children in their care was absolute. So it was very striking to us.
Thank you.
Next one's Francis.
Francis,
Hi, Fran.
you're muted.
We don't hear you, Francis. You have to put on your micro.
You're still muted, Francis.
No.
You're muted, Francis.
We don't hear you, Francis. No, your microphone is.
I found it. I'm used to Zoom, and so Teams is a learning thing that I had to get up to speed just like that. So just wanted to make a couple of points. First of all, I'm a mother of someone who had a 10-year addiction. He's 24 years sober now. So as I like to describe it, I was in the trenches. And as a result of that, I started a support group that is still going 25 years later, called Parents Forever, where we provided support to families in their own right. So how were their lives being impacted? And when I hear you talking about these families and the struggle, I'm thinking of how isolated they were. Like they had no one to support them, no one that they could problem solve with, that they had any tools. They didn't have a toolbox. All the things that we've helped families build over the 25 years in Parents Forever. So I think, from the time of this study to now, there's been some positive things that have happened in terms of a little bit of focus on the families and how they're affected and what they need. And also the mention about boundaries. One of the tools in that toolbox is negotiating an agreement with your loved one. And I have to say that is truly the tool that has served me the best over the years, because even when I couldn't possibly have full attention from my son, we could negotiate some kind of an agreement. And what I liked about the agreement is if it was breaking down, if it was not working, it I was not the bad person, he was not the bad person. The agreement wasn't working, and we could renegotiate the agreement. So the conversation would be, we had an agreement, it doesn't seem to be working, we need to talk about it again. And over the years, in the addiction and even to this day, negotiating an agreement really has helped. So it's different than boundaries because you're both involved in it. So as I mentioned, it's one of the tools in the Parents Forever toolbox. And I've worked with Amy and Jennifer recently in the last 2 or 3 years, looking at all the constructing the Parents Forever architecture, what has helped make it work for 25 years. So that's me. And tough love, honestly, that word was something we never used because we felt that bottom, we were worried about that bottom, as Mike said, we felt that bottomless pit around that. So we realized that we needed communication, it was about relationship, what Mike is talking about. So much of what you said, Mike, resonated. It's what we've talked about all those years. So thank you. That's me, done.
Okay.
Said my piece. I'm always for the families and supporting the families in their own right, because I think the focus is often, it's rightly so in helping the person who's using the substances, but also the families. They suffer in ways that people they would not believe. They come to a group like Parents Forever, the gas tank is empty. That's how I like to describe it. There is no gas left.
Right. Greg is next.
Hi, how are you? Really enjoyed that. Tough love is something that we would have used that terminology in Ireland quite a lot. We tended to move away from it because I suppose the nuances that go with that. What we tend to look at with people is around what their tolerance levels are. A lot of people are enabling, but it's a misguided sense initially. They believe that they're helping the individual. They're trying to keep things together as best they can. They think they can fix it. What we work with is around trying to empower the families to take back the control away from the substance user, where it's then the family can decide and set the ground rules and the boundaries and things like that. We don't use we've moved away from using the terminology around rock bottom. We tend to use a turning point. A person has hit a turning point. The other thing is I would have been, if I had a dollar for every time a person has said to me, should I put them out or should I have done that, I'd be quite rich at this stage. I work a lot now with trainee counselors and psychotherapists, and that's always a question that really comes up for them. And my advice always to them is never answer that question, because the person that you're dealing with is quite vulnerable. They're seeking answers. It's around working with them to understand what's going on, to be able to see if they can cope, if they can manage the situation, and it has to be their decision. Because if something goes wrong, then it's, well, Greg advised me and I went to see him because he would be perceived as somebody who would know about this type of work. So again, it all comes back to the empowering the families. And a lot of that is done initially in the stages of a kind of a psychosocial education based informative. So the more information that people has, they're in a better position to make an informed decision. And that's what we're trying to do with a lot of people. And again, that's kind of one of the areas that I'm quite strong with the trainee counselors and psychotherapists, because it is a case that people think, oh, I'm going into this and I'm going to fix people and stuff. Well, people can't fix, you can't fix people. People can fix themselves. You're there to help them. So I'll leave it at that. Thank you very much.
Thank you so much, Greg. I think I want to read out a comment from Kennedy before your question, Richard. More of a comment for thought. I have a qualitative study I'm writing up now focused on addiction-affected family interactions, and the salient finding is that many of the conflicts that arise within these families surrounds arguing about what is considered tough love, enabling, not all members agreeing on their approach. These conflicts seem to divide the household and adds to the anguish and chaos. Personally, this was something I saw within my family as well, and these divides still influence our family dynamics years after my brother has been sober. Thank you so much for this comment, Kennedy. Now, Richard has a question.
Okay, thank you, Anya. Thank you very much, team. I thought that was a wonderful presentation. I thought you passed the baton fantastically amongst yourselves, but it was full of really thoughtful ideas and thoughtful comments, as well as being very, very nicely delivered and put together. So thank you so much for that. There were so many resonances with so many other things, which we know a lot about in AFINet. The lack of attention in policy. I wrote a paper which came out in 2010, so 16 years ago, about how families were not represented in policy, and that was mainly looking at things to do with the UK and some European Union. And here we are, you talking about what's going on 16 years later in the west of Canada. Somebody said how Francis, I think, how things have moved on over the last 25 years, and they have, and it's lovely to see that. But it's also, you can be forgiven for think that sometimes these things move very slowly. It would be nice to see more policy recognition of families and the effects on impacted family members. There are lots of questions that I would like to ask about, and in fact, I'm also interested in Anya's comment that tough love has not come across in a German translation. I think that's very interesting, because so much of the 12-step movement has come across in every country. So I just wonder how that concept, which comes very strongly from the 12-step movement, has not been translated into German. But that's a conversation for another time. What I'm really interested in is two things. One is about disagreements in the family. And it's one of the things that I think we concentrate quite a lot on within the 5-step method, when one's talking about coping, and how important it is that family members talk together about the different ways of coping and different ways of dealing with the situation, and how there isn't a right way of coping. And that means within a family, there's not going to be a right way for each individual, but how important it is that different family members look at the different ways that they're using to cope, and how they can be in some sense integrated together. And that's, I think, a terribly important part of what we do in the 5-step method. I think it's terribly important in any work when you're dealing with families, trying to cope with this incredibly difficult dilemma. What came out very strongly was the dilemmas of how you deal with someone in your family who's got an addiction problem, and how there isn't a right way of doing it. I suppose what I'm really interested in, my question for you as a team, is your title of your paper and the type of the talk is, I don't know what we should have done differently. And I suppose I'm interested in what your answer to them might be as a result of all the work you've done. What should people have done differently?
Well, I'll jump in and take a stab at this. I think, oops.
Sorry, can I just quickly mention to say hi to Daniel Snyder? So he's on here now. He was a co-author of the paper and wasn't able to present with us, but I just wanted to mention him as part of our team. So Daniel, after Amy's, if you have anything to add, just please feel free. So that was it, Amy. So please go ahead.
Oh, no, thanks, Jen. Hi, Daniel. Nice to see you. I don't know that I would say that the families should have done anything differently, because the only thing that we could identify as what people should have done differently, I think was they should have had more support to keep from running out of cope. I think it's a phrase that we've kind of taken up on our team quite a lot, right? There is no one right trajectory, but I think it was that when families were reflecting on that, I don't know what I should have done differently. There's a few things that come to mind for me. So one is, I think we had a very significant public policy change in our substance use policy in British Columbia. Over a period of about 15 years, that was one that was very abstinence oriented, and focused on treatment and to the exclusion of harm reduction. And then we had a public policy change that that prioritized harm reduction for very important reasons, that was also claimed to follow an evidence-based approach. So abstinence-based was seen to be not evidence-based. Harm reduction was seen to be an evidence-based approach, which was also interesting to me, and looking at how this discourse is changing over time. And now we've sort of gone back a little bit again, because we've also, I think, seen that, well, myself, I worked in harm reduction services for 20 years, and I believe fundamentally in the importance of these services. Harm reduction alone, without the expansion of other access to support, has not, it hasn't met the grade in dealing with our toxic drug crisis in BC. And so the family members, when they're talking about what they should have done differently, I know that these experiences sort of also map on to this change in policy, where it was like, well, okay, we'll try doing it this way. That was the wrong way. Okay, we'll try and do it the other way. That's also not the right way. And it's that being caught in these very, very ideologically charged and polarizing political debates about how to help somebody you love the most in the world deal with the most difficult thing that they've ever dealt with. That was very challenging for families. In another paper, we looked at at family members' access to coping. I think this is about to come out in Substance Use and Misuse. And when family members talked about that trajectory where they had lost contact with their loved ones, a thing that they often noted, and that we noted as well in the data, was that the critical moment for them, where that fracture in that relationship occurred, and they put someone out of the house, or they said, you can't talk to me anymore, or we're doing some of these things that might be associated with tough love, were never really like the worst things that person has ever done. It wasn't like, now you've hit my limit, by doing something so egregious. In fact, what tended to precipitate these ruptures in relationship was the family members running out of cope. And so the way that we've been approaching this in our subsequent work with Fran is to say, okay, if we really want to prevent people from being alone, and we want to support resilience in relationships, things that should have happened for those family members is that circle of support should have been around them, really to prevent them from running out of cope, so that fracture in the relationship was not seen as the only possible solution at a moment where everything just feels overwhelming and you're completely depleted. I think coming back to some of Steve's comments here as well.
I think that term running out of cope is fantastic. I really like that, and I think we should all use it a lot more. I think that sums, and people have talked about sort of the God, I can't think of the expression at the moment. The thing that breaks the camel's back, the hair that breaks the camel's back. It's not the biggest thing. It's just the last thing, which means that people just run out. So I think that's a really helpful idea. Thank you.
Yes, are there any more questions? And I want to also mention that Greg also linked a study in the chat. So if you're interested in a study with 250 person sample, I guess, in Ireland, with families affected by a loved one's addiction, then you can click on the link. And Agnes also posted a comment. I really appreciate what you shared, Amy. What support do they need to not run out of cope? Starling's community, we work with youth, adult children who have grown up with parental substance use and with parents who use substances. We found the term tough love can create disconnection between families and services and can reinforce internalized shame or beliefs or I am the problem. So for us, the most important question we ask is, what does this youth or parent need? In any case, great conversation. I love the nuance that everyone brings into this conversation. Thanks, Agnes. If no one has a question, I will ask one. If we have time. Yeah, we have. I like that you had not only parents and wives, but also friends and 3 siblings and I guess 1 cousin. So this is interesting because it's not easy to get other persons than partners or parents or children of substance using parents for a study. Did you Anna, were there any differences between different family members or concerned significant others? Were the differences between siblings and wives or friends and siblings?
I would say what we noticed, and please, if anyone else on the team has more to add, feel free to cut me off even. What we did notice is that the closer they were to the epicenter of some of the chaos or some of the symptoms of a problematic relationship, like spouses or parents, the more the greater the level of that anguished, the dissonance, but at the same time, the attitudes and the thoughts and the approaches were across the board. The perceptions of tough love and the lack of, I mean, just how those concepts were integrated into decision making, they were fairly the same. It was just the level of how fraught the situation was seemed to intensify with the degree of proximity, but that could also apply to a sibling who is living in the house. Just because of our sample size, we couldn't really do much more than that. That's the only comment I would make. I don't know if anyone else.
I guess maybe just to jump in, not so much from the data, but again, sort of from the policy and service context in BC, is that well, we noted that services like support services for affected family members are fairly thin on the ground. What we do note is that often participation in services that support loved ones is often tied to their loved one's participation in some sort of substance use program. So coming back to the issue about supports in their own right being thin, because of that, I think there can also be a policy effect that would result in some family members, and I don't want to say having more access to support, because I don't want to give the perception that more access is adequate support. But I think if you're calling a program and wanting to connect to supports as someone who is a parent or sort of a first degree relative, maybe a sibling, you might be recognized by the system as having a bigger role in the life of your affected family member than, say, someone who is a cousin or a friend or a neighbor, and that assumption isn't necessarily borne out by people's lived experiences.
Thank you. If there are no more questions, I want to thank you all for this really great and interesting presentation. The session was recorded, so probably by the end of the week, the recordings will be online on the website. And before you start your day and we end ours, I want to mention the next webinar, which is on July the 15th at 3 p.m. UK time, and comes from the United States this time. And Alexia Florentine from the Texas State University will be presenting about holding on and letting go, supporting families through ambiguous loss and addiction. I'm really looking forward to this presentation too. So thank you all again for this great presentation and the great discussion and your engagement. And I'm looking forward to the next time. Bye.
Thank you all. Excellent. Thank you again.